The National Institutes of Health says millions of people across the country receive medical care for spine problems each year. Newswatch 16's Justin Gick explains what warning signs people should look out for in tonight's Healthwatch 16 report.
Healthwatch 16 is sponsored by UPMC, Life-Changing Medicine.
Many people across the United States deal with different spinal conditions. The National Institutes of Health says spine problems are some of the most costly and prevalent health problems in the industrialized world. Dr. Fadi Swice, a neurosurgeon at UPMC Neurological Institute in north central Pennsylvania, says there are many spinal conditions that are treated with surgery. He says a lot of which are from degenerative changes of the spine.
That can include disc herniations, disc ruptures, some structural changes which lead to instability of the spine, traumas such as fractures.
Dr. Swice says general significant degenerative changes that lead to spinal stenosis or conditions in the cervical and thoracic spine can lead to spinal cord compression as well. But surgery is not the only option when it comes to certain spinal conditions. Dr. Swice says doctors like to focus on making surgery the last option they try.
A lot of times we're looking for conservative measures that'll help the patient. We always start off with physical therapy, certain types of medications which can help with the pain that's associated with some of the conditions we see in the spine.
Dr. Swice says with physical therapy, there is always a slightly more aggressive treatment, such as pain management, which is where they can do injections targeting certain nerves, joints, and pathologies to help with pain. He says there's always a lot of success when it comes to pain management prior to considering surgery.
If you continue to have pain, or if your pain progresses or your symptoms progress, despite doing things such as physical therapy, certain medications, and even pain management, that's when we start considering surgical treatment options.
Dr. Swice says the spinal pain they see most commonly is pain that goes through your lower or upper extremities, depending on where the pathology is. He says pain a lot of times can be manageable, but at times it can be very severe. Dr. Swice says the biggest warning signs is progressive severe intractable pain, numbness and tingling, and weakness.
When it comes to the neck, concern with dropping things or problems with your balance, things get pretty concerning when you start having changes with both your urinary and your bowel habits. So those are things to consider.
Dr. Swice says if you develop sudden nerve weakness or pain, numbness or tingling, those are times when you should seek medical care, whether that's calling your primary doctor or even his office to figure out what the next steps are. He says you can also present it to the emergency room just for evaluation to make sure it's not something urgent that needs to be treated. For this Healthwatch 16 report, I'm Justin Gick, Newswatch 16.